I said, COVID-19 didn't only shape this conference.
It also showed the existing gaps and problems concerning global health as well as ABR. It clearly showed the dependency on sole manufacturers that causes supply disruptions and shortages of essential medicines. We saw that many guidelines on infection prevention and control are based on weak evidence, and there's urgent need to foster research on IPC measures. We saw that the poorest have the biggest risk to get sick and die. And we saw that strong health systems and universal health coverage could make a change. All these issues are key aspects of our work. Not just now. Since 4 decades, Pharma-Kampagne has been committed to global health. The following lecture will present some details on that. I'm happy to welcome Alexander Lohner now, consultant at Misereor and a long-standing advisor and companion of Buko.
Dear ladies and gentlemen, dear friends. At that time, when the Buko Pharma-Kampagne moved into its offices at Welthaus Bielefeld in January 1981, no one could have guessed that the campaign against the practices of the pharmaceutical industry in the Third World would become a great success. To this day, it keeps a watchful eye on the research-based pharmaceutical industry. The first issue of the Pharma Brief circular appeared in April 1981. Just a few months later, the campaign was presented at the Health Day in Hamburg. However, the newly founded organization garnered only little enthusiasm among the pharmaceutical manufacturers. The German Pharmaceutical Industry Association suspected an Eastern Bloc strategy behind the Buko campaign. Through its work, Buko Pharma-Kampagne reminds us again and again that poverty means illness and early death for millions of people. Statistically, a person living in Monaco in 2015 had the highest life expectancy at just under 90 years, while the lowest life expectancy was in Chad, Africa, at just under 50 years. A girl in Lesotho can expect to live 40 years less than a child of the same age in Japan. One reason for this is the unequal distribution of the benefits of science. Before the COVID-19 crisis, around $70 billion were spent annually on research and development in the health sector, but only 10% of this was spent on the health problems of 90% of the world's population. Too little was being done, for example, to combat tropical diseases or tuberculosis. Against this background, it cannot be justified that the products of the pharmaceutical industry are so expensive, especially with regards to medicinal products which are urgently needed in poor countries. The so-called TRIPS agreements are still having a devastating effect on the supply of medicines in the South. Patent-protected medicinal products become so expensive that hardly anyone in the poorer countries can afford them. Many nations do not even have the opportunity to use particularly important and necessary medicines, while elsewhere expensive medicinal products are even subject to abuse and waste. The COVID-19 pandemic has exacerbated these problems in a global scale. It has had a massive negative impact on health systems worldwide and in particular in poorer countries. In addition, the pandemic has caused significant economical turmoil, pushing millions of people into poverty and even increasing concerns about long-term famine. Children, young people and women suffer the most from the indirect effects of the COVID-19 pandemic. Worldwide, they face a massive deterioration in their living conditions, especially in poor countries. This means that achieving the Sustainable Development Goals by 2030 now seems a far-off prospect. More than 80 million children are unlikely to receive their polio and measles vaccinations on time or at all. Within 1 year, an additional 1 million children under the age of 5 could die, and more than 50,000 women could share the same fate during pregnancy, childbirth, and the postpartum period. Malaria, HIV/AIDS, and tuberculosis programs have been put on hold or even terminated. Moreover, the lockdown measures in many poor countries have led to millions of day laborers and slum inhabitants having no income from one day to the next. In rural areas, fields cannot be cultivated and crops cannot be harvested. Other sources of income have run dry, for example, income from tourism. Thus, the pandemic has caused considerable economic dislocation. Germany and other countries are campaigning for the COVID-19 vaccines to be treated as global public goods, which should be distributed worldwide according to a fair allocation scheme. But solemn declarations and moral appeals are not enough. South Africa and India propose the temporary waiver of certain obligations in the TRIPS agreements relating to the protection of intellectual property. The aim is to provide all member states with the option to suspend intellectual property protection for COVID-19 vaccines for the course of the pandemic and not to grant patents for the vaccines. This would allow products to be copied and imported. In order to protect people from suffering and death, to effectively hold the spread of the pandemic all over the world, and to combat its harmful effects, the actions of biomedical companies play an important role. German non-governmental organizations active in development cooperation, global health, and humanitarian aid, including BOCO Pharma-Kampagne, appealed to BioNTech to make its COVID-19 vaccine available in sufficient quantities and at affordable prices to people worldwide. With its educational and awareness-raising work, the BOCO Pharma-Kampagne is helping to ensure that many people critically measure the pharmaceutical industry against the idea of an ethical industry to ensure that financial interests do not dominate and the needs of sick people do not become even less relevant. In view of the COVID-19 pandemic, the BOCO Pharma-Kampagne is more necessary than ever. Ad multos annos. Thank you.